L3 towards, and then ask them to bend the knee. If the pain is reduced, if the movement is increased, then that tells me that's the right level. If there's no change, then maybe I need to go up one or down one. Yeah? So you move and change to see if you can alter the pain. Okay? So the goal is to try to just change that frame size as the patient moves the leg. Yeah? So if the pain was on the right, I would push the top one away, the lower one towards. Okay?
What did you say? Excuse me. The pain is produced.
If the pain is not changed,
okay.
Yeah, so then we need to change
Oh.
because we're not in the right place. Yeah. Okay. So we'll get the for the sciatic nerve, we'll get them on the side.
Doctor, if the range changed but the pain didn't change.
Well, if say they've got 90 degrees flexion of the knee to the pain's onset, and then with the pressure, the pain onset is at 120, that's a good change. Yeah, that's fine. Yeah. As long as something changes.
Range according to the pain onset.
Yeah. Okay. Now for the sciatic nerve, I'm going to push on L5, and ideally I'll push with two thumbs. Yeah. Push it down towards the floor while we do the SLR. Yeah. So the patient can do it actively, or we can have an assistant to support the leg and help the patient do the SLR. Yeah. But you press towards the floor. Okay. So let's see. Who would mind? Who would mind? That's it. Thank you. So get him to go prone first. So he's got this anterior symptoms. When I flex the knee, that's it. When he flexes his knee, yeah, it gets to a point when the pain comes on. Okay? I found out, based on my assessment, that he's got some problems in L2 and L3. That's where the most sensitivity when I press on his spine is. Yeah? And I can do other assessments, but I think that the problem is coming from these two levels. Yeah. So I press L2 away from the pain. Now the spinous process can be quite sensitive, so just make sure you use a little bit of soft tissue cushion to support the spinous process. Or the sponge, yeah. And then the other thumb, push in the opposite direction. So apply the force, and then ask him to flex his knee, and see if we can change the movement. Sometimes it's a bit awkward for him, so we'll get a belt.
Oh, yeah, sure.
Come up here.
Oh, okay.
Get onto his foot. Just going to hang on to that with his hands. So I'm going to come like this. Transverse pressure, yeah. So now he's pulling his foot. Keep coming. Keep coming. Now I get a little over pressure with my body weight. Yeah. So if we get to the end range with over pressure without pain, we know we're doing a good job. Yeah. Sometimes they're a bit more mobile, so you put a pillow under the knee and get some more extreme movement. Yeah. If it doesn't change the movement, change the level, apply the pressure, see if we can alter. No change, go to the one above. No change, forget it. Yeah.
Hold for more. Hold.
Not hold this one, just movement. Just go backwards and forwards. Yeah. Maybe the first time, use the rule of three times only. And if that's having a good effect, next time we can do 5, 6, 3 sets of 6.
Yeah. Can you demonstrate the first one?
Yeah.
The first one before we say it.
Sciatic nerve, I'll demonstrate that one. So it goes on his side, face me. Okay. So it comes a little bit closer. Yeah, that's it. Now we're going to find the L5. So we come to the iliac crest. just below the iliac crest. We've got L4, so that makes that L5. So that's pressing onto the spinous process of L5. Yeah. So again, use the soft tissue as a cushion to make it more comfortable. Yeah. Press one on top of the other one, and then ask him to actively do a straight leg raise. If that's a bit difficult for him, then we would bend both knees here, bend that knee, yeah, put that one on top. Apply the glide, and then do the move like this, yeah. But you don't get such a good effect with that one because this technique you have to work really hard. You've got to press hard. And if you're not getting the strong force, usually it doesn't work so well. Yeah.
It doesn't work if it can go up, liver or under.
Yeah, so maybe you got the wrong level. Maybe it's not the right one. So come to L4. Check there. Yeah. Occasionally it will be the L3, but not normally. Yeah. It's normally L5 is one disc, or the L4-5 disc.
And if the pain on both sides will be snug.
Bilateral. So if they've got a bilateral problem, then you can still do this technique. So you would choose the more painful side, treat that one first, and then later we can add the other one. Just do one side at a time. Yeah.
Snag not good for
Not snag. Not snag for leg pain usually.